How is IVF performed? Step 1. It is the first step of the IVF process. This involves monitoring of the ovaries, the release of the egg and its timing. The fertility doctor will ensure that the hormone levels are at optimal levels. It is seen that the ovaries are producing eggs as needed. If the ovaries are not producing requisite eggs, fertility-boosting medications help stimulate the ovaries to ovulate and produce eggs. With the help of this, the ovaries produce several eggs within a short period. Step 2. Egg retrieval is the second step. After administering pain medication, a thin needle is inserted into the vaginal wall. With the help of ultrasound, fluid is extracted and then the egg, oocyte, is isolated from that fluid. This is transferred to a culture dish and then to an incubator. Step 3. Now it is time for the fertilization of the egg with the sperm. The sperm sample may be from a partner, volunteer or a sperm donor. The most active sperm is brought into contact with the egg either in a special chamber or by direct injection into the egg. Step 4. The subsequent process of embryo formation is closely monitored. The quality of the embryos is assessed to rule out any disorders or abnormalities. The healthiest and strongest embryos are identified for transfer. Step 5. The last step of the IVF procedure is embryo transfer and implantation. The sturdiest embryos are then transferred via the cervix into the uterus for implantation. This is followed by complete bed rest to give the woman the best chance at conception. Types of IVF treatment. Used in cases where the embryo is thick. This reduces its ability to hatch on its own. Gap or hole is created in the outer shell of the embryo with the help of laser so the embryo may hatch. When the eggs used in fertilization comes from a woman other than the one undergoing the procedure. Intracytoplasmatic sperm injection, ICSI, where the sperm is directly injected into the egg for fertilization and the resulting fertilized egg placed in the uterus of the woman. Sperms of a suitable donor other than the male partner of the woman undergoing the procedure. This technique helps the fertility specialist view the division of cells carefully to ensure no damage takes place around the site of injection of the sperm. The fertility specialist may order a testicular biopsy to assess the testicular function in the male partner. Candidates for IVF. Women who have tried for a long time to get pregnant but have been unable to do so may be advised to opt for injectable drugs, intrauterine insemination, IUI, or other alternatives. If these conventional therapies do not work to help a woman conceive, IVF is advisable, particularly if there are certain underlying conditions responsible for the difficulty in getting pregnant. Women with ovulation dysfunction, blocked fallopian tubes, PID, pelvic inflammatory disease, PCOS, polycystic ovary syndrome, endometriosis, uterine problems or problems relating to cervical mucus are typically advised to opt for IVF if they fail to conceive. Global success rate for IVF treatment is 40%. Factors affecting success rate of IVF treatment. 1. Age. Your age and using your own eggs are important factors to consider for IVF success. 2. Previous pregnancy. If you were pregnant previously with the same partner as in the current IVF treatment, there is a greater probability of IVF success. Factors such as a history of recurrent miscarriage or a different partner may reduce the chances of IVF success. 3. Type of fertility problems. While some male infertility problems do impact IVF success, factors such as uterine abnormalities, exposure to estrogen medications or fibroid tumors also decrease the chances of successful IVF. When both the partners are infertile with lower chances for IVF success, factors such as the length of time you have been infertile is important to consider. The chances of IVF success decrease with the amount of time a couple has been infertile. 4. Use of donor eggs. Donor eggs are a significant consideration, especially if you are over 35 to 40 because in such cases, the chances of IVF failure are more. Factors such as egg quality and age of the donor are important. Using donor eggs from younger women may increase the chances of pregnancy for women over 40. 5. Fertility Clinic. The center you choose to get IVF treatment done can greatly affect your IVF success. Factors to think about when reviewing the success rate of fertility centers include: A. The training and experience of the infertility specialists. B. The live birth rate per IVF cycle. C. The rate of patients pregnant with multiples, twins, triplets or more. D. The quality of services offered by the clinic.